Health Digest, brought to you by Aga Khan University Hospital.
When one gets the news that they have a heart condition, it can be devastating, particularly for children whose whole future lies ahead of them. Many ask themselves questions about the origin of this heart condition, where to get the relevant treatment like surgery, or even how much this would cost, a question that really causes a lot of strain, emotional and financially, in families. My name is Dr. Mercy Korir, and on this episode of Health Digest, Gloria Milimu visits the Aga Khan University Hospital in Nairobi, where some of these questions are answered.
Since nilikuwa mdogo, nimekuwa na complications mingi. Like, singeweza kutembea for 2 steps nikiwa sijakaa chini. And singeweza kufanya anything. Lazima nipumue haraka and kufaint. Nilikuwa na faint kila time.
These symptoms should be a red flag and an indication of an underlying or looming health complication. However, more often than not, they are ignored, just like in Juliet Mbula's case. It took Mbula about 20 years for doctors to point out the exact cause of her agony.
Back home, kila mtu alikuwa anafikiria hii ni kitu normal umezaliwa nayo, so you have to stay. So hakuna mtu ashifikiria kunipeleka hosi ama niangaliliwe nini.
Before her diagnosis with congenital heart defect, Mbula says doctors would prescribe her medication to manage her symptoms.
Kuna time ilikuwa mbaya kabisa. So nilikuwa nikipelekwa hosi, walikuwa wanaenda wanasema ni kitu yenye niko nayo ni pressure yangu iko juu. So nilikuwa napewa hizo dawa za pressure na kunywa for some time na kuja naacha. Nikiacha inakuwa saa ile mbaya kabisa, like nikienda shule sikuwa naweza kaa shule hadi saa 10. Nilikuwa tu ile nimezoea. Mimi nikienda shule by saa 5 nishakuwa mgonjwa. So nilikuwa narudi home anytime.
At this point, Mbula had become a frequent visitor to hospital. As the number of visits increased, so was her quest to understand her ailment that was even more persistent. The symptoms had by then robbed her of her childhood and ability to learn uninterrupted like her peers.
Mi maishani nilitaka kuwa daktari. But nilikuwa naona hii kitu niseme tu ni dream, imekufa tu hivyo juu sioni nikikuwa daktari. Juu nilikuwa naenda shule, unapata hours zenye nasoma ndo kidogo. Zile mingi ni zenye sisikii vizuri, hadi napoteza sight. Unapata nasoma but hata sielewi chenye nasoma. Alafu headache, nilikuwa hata saa ingine nashika kitabu naona hii headache venye imenisukuma, acha tu niachane tu na kila kitu yenye nafanya.
She reveals that her diagnosis with a hole in the heart came after misdiagnosis with pneumonia. This came after experiencing another episode of fainting. However, an unusual heartbeat is what caught the doctor's attention during one of her examinations.
One morning, nikaamuka ukapata nasikia kizunguzungu kabisa. Nikavaa nguo, nikasema acha nitoke. I had my cousin. So yeye alitoka mbele, mimi nikabaki nyuma. So before nifike kwa gate, nikafaint. After nimefaint, uncle yangu akasema wanipeleke hosi. So I was taken, nikaambiwa ni pneumonia. But akasema ataangalia the heartbeat. So aliangalia the heartbeat, hakuweza kuhold for 2 minutes. Akasema hii kitu ni serious. Nafaa niende niangaliliwe hizo heartbeats kwa nini zinaenda hivyo haraka. Nikaenda nikafanywa x-ray. So after nimefanywa x-ray ndo daktari alisema niko na heart disease, ni venye sijaijua mapema, but this stage mali imefika inafaa iangaliliwa haraka before ikuwe something big. So nilikuwa hapo nikaanza kulose hope. Kasema hiyo miaka yote nimekaa na hii heart disease na sijaijua.
The news of her heart's condition came as a shock, not just to her, but her mother too.
Haikuwa rahisi madam. Ilikuwa ngumu sana kwangu. Kasema mimi sasa, hii ni familia yangu, hatuna uwezo. Daktari ananiambia hii itabidi afanyiwe. Lakini kwanza nikaita Mungu. Na nikaambia Mungu, ni mimi sasa na wewe na watoto wangu, na familia na daktari mwenye ataona mtoto wangu. Niliambia tu Mungu, nimekuachia mtoto wangu, na nilikuachia kutoka kitambo. Kutoka zamani mtoto alikuanga na shida. And up to this minute hatutashindwa. Mungu hakuna vile tutashindwa. Na Mungu akanishika mkono. Na kila mtu mwenye alisikia mtoto wangu akona shimo kwa moyo akafeel. So haikuwa rahisi kuambia mtoto akona shida ya moyo, sababu najua hizi mashida vile zinakuanga.
Surgery was Mbula's recommended mode of treatment, and just like any other patient, the thought of undergoing the sensitive procedure was scary for the 23-year-old.
Sasa ukienda ile surgery room, uko umeshtuka, so unasema, "Guy, I won't make it." Sasa yangu imeisha hivyo tu leo. Lakini nilipatana na doctors wenye caring, nurses, unapata wananipea hiyo courage, wananiambia, "Juliet, you can do this. Umekaa nayo since you are too small. Ni kitu imeshiku kwa attack, but for now at least jusu umepata kuna venye inawezaisha, so you have to stay with us." So bado nilikuwa nimeikataa, but I had to do it. So after nimefanyiwa surgery, nilikaa for some time huku hospitali, nika recover kidogo, nikaenda back home, ukapata bado nasikia hapana, bado si uko poa. So nikaambiwa nifuate hizo medications zangu, nitakuwa poa. So by the time nikafuata, ukapata hakuna kitu na delay nayo, and now I'm good. Naweza fanya everything yenye sikuwa naweza fanya kutoka kitambo. Sikuwa naweza inua kitu heavy, sikuwa naweza inua. Kutembea sikuwa natembea, hata kupanda stairs ilikuwa shida, but for now I'm doing all that.
A medical camp for patients with heart conditions came as a financial relief for Mbula's family. After all, they were staring at a medical bill that could hit over 1 million shillings.
Unajua lazima ningetafuta pesa ya surgery juu the surgery ina cost sana. So, mom had to kutafuta ile kidogo, the hospital itastand na mimi. So, nikakuja, that is October, date 16. Hiyo ndo siku nililazwa huko Aga Khan. So, my surgery hapo ndo nilifanyiwa.
Nilikuwa na open heart clinics huko. So akanipigia picha, akaniambia usifeli kwenda Kenyatta. Nini Aga Khan. Mimi nafanya kazi za nyumba. Nikamwambia bosi wangu lazima niende wapi? Nilimwambia mamu lazima niende wapi Aga Khan. Nikawaonyesha. Sasa nilikuwa nimetumiwa kwa WhatsApp. Akapiga picha akanitumia. Kuna hii na nikamwambia lazima niende Aga Khan. Nilifika hapa nilikuwa saa 1 pale Doctors Plaza. Hapo ndio tulikuwa tumekaa, tulikuwa watu wengi. Mimi nikapokelewa kama mtoto yatima. And I do thank Aga Khan. Mungu awabariki sana. Mimi wakanichukua, wakanifanyia kila kitu. Mtoto akapatikana pressure zake ziko juu sana. Nikapewa dawa za kwanza mtoto wangu kumeza za hiyo shida. Niliandikiwa na Aga Khan Hospital. Ambapo mimi nawashukuru sana. Sasa from there mimi nikatumwa kwa welfare. Na watu wa welfare wakaenda wakanitisha details zangu. Karo akanipokelea vizuri sana. Mimi nashukuru. Ile mlango niliingia ya Aga Khan, mimi huwa nashukuru, naambia Mungu tu ni asante.
So, what are congenital heart defects?
Congenital heart disease is one of those defects that children have at birth, which involve the heart and some of the great vessels or the main vessels that originate from the heart. It is the commonest heart defect that we see in children here in Kenya as well as globally, affecting approximately 1 to 2% of all live births. And this poses a huge burden on the health sector here in Kenya and sub-Saharan Africa.
There are different forms of congenital heart defects. Dr. Sean Del Rossi, who is a pediatric cardiologist at the Aga Khan University Hospital, classifies them in 3 groups.
The first form is where we have a hole in the heart. We know that the heart has a right side and a left side, and blood comes from the right side, goes to the lungs, gets cleaned up and purified with more oxygen, and then comes to the left side of the heart. When we have a hole in the heart, we have an abnormal communication between the right and the left side. So we have got mixing of blood. This mixing of blood leads to a low oxygen level in the main blood that goes to the rest of our body. It leads to a couple of complications. The second group of congenital heart diseases or defects are those that have some obstruction in the heart. Either inside the heart, where we have a valve which is partially or completely obstructed, or one of the blood vessels that come from the heart. The third group, which is a more complex group and that poses a bigger challenge for us for the care of these children, is when they have a combination of the first 2 types, where we have a hole in the heart as well as some obstruction to the heart or impeding the blood flow.
He says the defects that manifest in the form of a hole in the heart are picked in late childhood or early childhood. But the more complex conditions, where more blood from the left and the right side of the heart mix, present themselves as soon as the baby is born. According to Dr. Del Rossi, these signs are more pronounced.
As soon as a baby is born, the more complex lesions will present at that time, when the baby is 1 or 2 weeks of age. These babies usually have severe difficulty in breathing, their oxygen level is a bit low, and we require to give the baby some sort of oxygen or put the baby on mechanical ventilation. Because of the mixing of blood and the low amount of oxygen in the blood that's going to the body, these babies appear blue. And we see the blueness on the nail beds or around the lip. And these are the babies that require more intervention. The second group of babies who grow up and survive the neonatal period, some of the signs and symptoms that we can pick up are, again, difficulty in breathing. And these are the children who get tired while playing, while running around. They might even faint or collapse while playing. They also have blueness of the nails or around the lips. These children also are in and out of hospital because of treatment of recurrent chest infections. Apart from that, and because of all these symptoms, these children use a lot of energy, a lot of their calories on the heart defect at the expense of their own growth and development. So these children appear smaller than their peers at the same age group. They appear shorter as well, and these are the children that need to be scanned for any congenital heart defect.
Whereas some congenital heart defects may be captured during pregnancy, there are those that are detected much later after birth.
So first, whenever we see these children and we suspect some congenital heart disease, we have to examine the children. We listen to their heart using the stethoscope, and here we pick up some abnormal heart sounds, what known as a murmur. So depending on the lesion and depending on the type and location of the lesion, we're able to pick up some of these conditions. The mainstay of how we make these diagnoses is the use of an ultrasound known as the echocardiography to examine the structure and the function of the heart. We can use other modalities like a chest X-ray, the CT scan, or a cardiac MRI to help us aid in making these diagnoses.
The main way of making this diagnosis is the use of an ultrasound, also known as echocardiography, to examine the structure and function of the heart. Other modalities like the chest X-ray, the CT scan, or a cardiac MRI also help in making these determinations. Congenital heart defects are the common birth defects. The doctors say occur in 1 to 2% of all live births, and 50% of children born with this condition will require open heart surgery as a mode of treatment.
What this entails is a baby to go to the operating room, be put on a special machine called a bypass machine, and where the cardiac surgeon repairs that defect in the heart. The other 60 to 50% of children with minor defects like the holes in the heart can be sorted out in our cardiac cath lab, which is a less invasive procedure where we take a small tube and put in one of the major blood vessels, either in the neck or in the leg, and push that tube known as a catheter all the way into the heart. And through that tube, we push in a special device all the way to the lesion or to the hole, and we close the hole of the baby.
After the surgery, the patient can lead a normal life. But for the complex defects, more than one surgery done in intervals may be required during the affected child's life. Doctors say the causes of congenital heart disease among children in most cases is unknown. However, some factors can predispose one to these defects.
We know that the baby's heart starts development approximately between the 6th and the 8th week while the baby is in the uterus during the mother's pregnancy during the first trimester. So a couple of issues that can affect the normal development of the heart include some of the medicines that a mother might use during her pregnancy, things like alcohol, some illicit sort of drugs and other medication, various infections in the mother, viral infections, bacterial infections that might cause not the normal development of the heart. Other conditions that the mother might have are some genetic conditions that may also affect the development of the heart.
Many cases of congenital heart defects get misdiagnosed, just like in Mbula's case. Dr. Del Rossi attributes this to a shortage of specialists in the country and unavailability of equipment for diagnosis in most health facilities.
Because Kenya is still a developing country, and the facilities, for example, echocardiography and the machine, CT scan, MRI, is not widespread throughout the country. So most of these children, especially in the rural areas, in upcountry, are usually misdiagnosed for various other infections, more commonly the pneumonia. So these children are admitted to hospital, treated with various IV antibiotics and other medications, not once but on a recurrent basis.
However, the Aga Khan University Hospital has been standing in the gap in its own way through its medical camps and cardiac surgery program. It is an initiative that gives patients with congenital heart defects like Mbula a second lease of life. Dr. Del Rossi says the hospital's cardiac surgery program was meant to cater for older patients when it started. But over the last 4 years, they began conducting surgeries on children with congenital heart defects. In the last 2 years, about 12 children, including Juliet, have benefited from the program.
Okay, so here at Aga Khan, we're able to make diagnosis or pick up these children with congenital heart disease as early as the 2nd trimester during a mother's pregnancy, where we can do an ultrasound, the normal routine ultrasounds, and pick up those conditions. These are the children where we plan for their delivery here in Aga Khan, transfer the baby to our neonatal ICU, which is one of the best in Kenya and in sub-Saharan Africa. We also run, for the older children, we run a clinic every day from Monday to Friday with the use of echocardiography, CT scans and MRI, which are well developed here at Aga Khan. We also have 2 cardiac cath laboratories where we're able to close some of those holes that we were speaking about with those special devices throughout the week. And currently we have got a well-established cardiac surgery program where we do surgeries for congenital heart disease in the older children and younger adults, just like in Juliet's case.
Treatment for congenital heart disease is not cheap, but through the program, Dr. Dilrosi says treatment is made accessible to those who ordinarily cannot meet the high cost.
Aga Khan is geared to help children with congenital heart disease who really can't afford the surgeries. Finances has been our biggest challenge, not only in Aga Khan but in Kenya as a whole, as congenital heart disease poses a huge burden on the health sector. Some of these surgeries cost almost 1.5 to 2 million shillings. And we have benefited from the National Hospital Insurance Fund, which is now funding almost about 500,000 towards these congenital heart disease surgeries. We also have the welfare program that helps us, and in the case of Juliet, she benefited hugely from both the NHIF program as well as the welfare program.
And now, in a bid to keep these defects at bay and help patients live a normal life, he calls for awareness creation on the issue. More importantly, he is pushing for joint efforts among specialists in a bid to ensure the best health of mothers during pregnancy. Gloria Milimu, KTN News.